Medical radiography has always been a stressful job. Today we're going to look at factors that cause stress for radiographers. Occupational stress for radiographers. Radiographers are the initial healthcare providers for patients and interact with all other healthcare professionals within the healthcare system. This causes many opportunities for miscommunication and stress. As a healthcare provider, you're often in a very stressful situation, such as an intensive care unit, an emergency room situation, surgical situation, or just interacting with people in the clinic. What is stress? It is an imbalance between demand and the ability to meet those demands in the allotted time frame. Let's take a look at some facts. Workplace stress in the United States costs its employers an estimated $300+ billion a year in absenteeism, lower productivity, staff turnover, workers' compensation, medical insurance, and other related expenses. Hospitals have problems just like all businesses. One of the major ones is variations in work hours or conditions, trouble with the boss, and altered responsibilities. So let's talk about stress and well-being in the medical imaging workplace. Changes in technology in the imaging department and an emphasis on multitasking can lead to stress and burnout, along with the potential for medical error. How many medical imaging departments have you heard that were overstaffed, or how many have you seen that were understaffed? Well, for the medical imaging worker, they seem to be understaffed, and for the healthcare provider who is paying the salaries, they're overstaffed. Stress is a feeling of tension that occurs when a person perceives that a situation is about to exceed his or her ability to cope and consequently could endanger his or her well-being. There are several symptoms of stress that we should be aware of, and these include everything from trouble concentrating to fatigue, to stomach problems and muscle tension. There are both negative and positive types of stress. Eustress is a desirable type of stress. The outcome of a desirable type of stress often motivates and causes good results. If we have distress, it is a negative outcome and results in emotional and physical illness. Stress is a very common problem, and there has been considerable research on stress in certain healthcare professions. However, not as many studies exist about the importance of occupational stress on radiographers. Just because there aren't a lot of studies doesn't mean that radiographers don't have stress. With my experience in the field for many years, I can guarantee that there's a lot of stress for radiologic technologists or radiographers. The studies that do exist indicate the prevalence and impact of stress on a radiographer is considerable, and that occupational stress in the radiography field is a very common health problem. A review of the literature revealed significant stress-related consequences on the physical and mental health of all healthcare workers. These findings can be applied to radiographers and used to reduce stress in the workplace. Sources of stress for medical imaging professionals are similar to those shown in most research of stress, including inconsistent management, poor management communication, conflicting demands, long work hours, excessive workloads, and a lack of work breaks, and many time pressures. Let's take a look at the 7 causes of medical errors. The number one cause is communication errors, such as misinterpretation of physicians' orders, resulting in dosage errors or a mix-up of medications with similar names. In medical imaging, you want to make sure that the ordering physician chooses the right exam for the right patient at the right time. Otherwise, we have a miscommunication in most cases. Another cause of errors is the old "too many cooks in the kitchen ruin the broth." With increasing specialization and fragmentation of healthcare, when more people are involved in a patient's care, there is more potential for miscommunication between the ward clerk, the nurse, the PA, the physician, on and on and on. Human error resulting from overwork and burnout, staffing reductions to cut costs, can lead to mandatory overtime and a greater ratio of patients to staff. Eventually, staff can experience inadequate sleep and increased stress, resulting in increased errors. Other causes of medical errors include manufacturing errors, such as mislabeling of blood products during the production process, equipment failures, such as a valve on an intravenous pump delivering an unintended amount of medication, and diagnostic errors such as failure to act on an abnormal test result, misinterpretation of diagnostic images, or a misdiagnosed illness. Finally, poor design buildings and facilities, such as sharp intersections that increase the likelihood of collisions or falls, X-ray rooms that are too small and you can't get the stretcher or the wheelchair around in the room, or just poor design and site prep for new equipment. Numerous surveys show that occupational stress is far and away the leading source of stress for adults, and that it has progressively increased over the last 4 decades. Everybody is unique, and so there's a lot of differences in stress levels for different people. There are different personalities, say type A versus type B, or pessimist versus optimist. There's differences in culture, gender, ethnicity, race, stress sensitization, and 7 distinct personality types, each taking stress and making it a different factor or impact on their lifestyle. So we look at stress in the environment and realize there's more than type A versus type B personality. Let's take a look at some of these personality types and see if we can match them to their job description. Number 1 is the performer, the rational idealistic type, principled, purposeful, self-controlled, and a perfectionist. Number 2 is the helper, the caring, interpersonal type. They are demonstrative, generous, people-pleasing, and possessive. Number 3 is the achiever, the success-oriented, pragmatic type, adaptive, excelling, driven, and image-conscious. Number 4 is the individualist, the sensitive, withdrawn type, expressive, dramatic, self-absorbed, and temperamental, usually the 3rd shift. Number 5 is the investigator, the intense, cerebral type, perceptive, innovative, secretive, and isolated, usually the portable tech. Type 6 is the loyalist, the committed, security-oriented type. This would be the mammo-tech. Type 7 would be the enthusiast, the busy, fun-loving type, spontaneous, versatile, distractible, and scattered. This would be the new tech. Type 8 would be the challenger, the powerful, dominating, self-confident, decisive, willful, and confrontational tech. And type 9 would be the peacemaker, the easy, self-effacing type, receptive, reassuring, agreeable, and complacent. This will probably be your immediate supervisor. So as you can see, there's all kinds of personalities, all types of cultures, and all types of people that you have to interact with. And this can cause stress. Personal stressors may come from fear, resentment, or even resistance. So let's talk about stressors that could be occupational. What we're looking at here is, first of all, role conflict. That would be between the requesting physician and the radiographer, or the radiologist when the requesting physician orders an exam that is not needed or inappropriate. Role ambiguity, or whose job is it anyway? Or how about role overload? Like you hire a multimodality tech. They can do CT, they can do X-ray, they can do surgery, they can do portables, they can do MRI. Of course, this is the only tech that you've hired for your facility and saving money at the same time. And also there is poor person organizational fit. Some people work better at different types of organizations than others. An example would be a single parent that is working in cardiology and is on call for heart caths. And how about work environment? There's a big difference working for a concierge hospital as opposed to the county hospital for the poor. Another big stressor is change. A lot of times hospitals get sold to new organizations, and this causes stress. Relationships in a department make a difference also. If you have to work with your ex at a small facility, it can be difficult. Some other frustrations might be due to just having minor frustrations available, or basically maybe some residual. You had a problem at the last place you were at and people know about it, so they're kind of giving you a hard time. Or forecasting. You don't think the job is really going to be the one for you. There are some consequences or organizational consequences of stress on the job. Of course, the first one would be job burnout. Then job performance. You're not going to be able to do the job as well if you're tired and burned out. Increased absenteeism, increased turnover of employees, and drug and alcohol abuse related to stress and trying to relieve tension. Occupational stress or burnout can be caused by a work environment that diminishes a person's health or sense of well-being. When workplace requires that the technologist or radiographer to take on multiple roles, he or she may become overly stressed and distracted by multitasking. The potential for errors increase as the technologist's stress level rises. Another real stressor is your work schedule. Many times they'll tell you you need to stay until the work is finished, or somebody did not come in for the next shift, you'll need to stay and work that. Conversely, if there are no patients, you're told to go home and take the day off without pay. We've all been told there's a way to manage stress or plan for stress, such as exercise, laughter, diet, sleep, etc., which is great, except what can you really do for self-empowerment that will get you the coping skills to relieve the stress right now? Well, let's take a look at a couple of ways where we can manage stress, and during and after stress, we can practice relaxation techniques and better time management. Let's look at some definitions for stressor, express stress, and strain. A stressor is a stimuli that forces us to adapt or change. Experienced stress is physiological and psychological perception of being stressed, and strain is the threat or damage to our psychological and physical well-being. So why do we look at work-life balance, or what's relevant in the workplace? To begin with, most people spend at least 1/3 of their lives at work. This makes the workplace a dominant source of demands or stressors. The workplace can also be a dominant source of reward and other resources that support our psychological well-being. Unfortunately, chronic, recurring exposure to stressors within the job environment can be really damaging over time. It's a sad thing that we even have to worry about gun violence in the hospital workplace. With the increase of workplace violence, we have to look at new security measures, better employee screening methods, and increased management awareness of violence in the workplace. Stress associated with work demands is a major health issue that can negatively impact on the well-being of workers in any occupation, especially healthcare workers. This is especially true of hospitals inundated by COVID-19 and now the trifecta of flu, COVID-19, and RSV. It is crucial for health administrators and fellow healthcare professionals to be aware of and address those areas of job-related stress that may impact the quality of patient care and the well-being of the allied health professional. One of the greatest healthcare problems that we have today relates to staffing and how staff are reimbursed. When we take a look at staffing, we also need to look at depression. Depression is the most common debilitating mental disease according to the World Health Organization, and it predicts that depression will be the second leading cause of disability throughout the world, trailing only coronary heart disease, to which it also contributes. With the stress we find in healthcare today, we also associate a great amount of depression within the healthcare worker community. Because of the high level of stress we encounter in healthcare, we find that our bodies are often experiencing the fight or flight syndrome, which can be beneficial in situations which an immediate threat exists. The rush of adrenaline with the fight or flight syndrome can be beneficial, as we stated, but on the other hand, it is detrimental to physical and mental health when this is happening over and over and over again in a short period of time. Stress is an inevitable psychological and physiological force that disturbs our equilibrium. Let's see if we can relate to what OSHA considers occupational stress, which is harmful physical and emotional responses which occur when the job requirements do not match the capabilities, resources, or needs of the worker. We're looking at things like long hours, our work overload, being constantly under a time pressure. The word stat exists throughout the entire hospital complex. Difficult or complex tasks, lack of breaks or variety, and poor work conditions. In other words, you may be describing working in a radiology or medical imaging department. Stress affects radiologic technologists who must interact with physicians, nurses, department supervisors, and then turn around and work with surgery, the emergency department personnel, housekeeping, maintenance, staff, and then on top of all of that, you've got patients and patients' families to deal with. Lots of stress. Often, medical imaging workers must work rotating shifts and handle trauma situations. In addition to knowing how to get the quality medical image, the radiographer or medical imaging specialist must also know how to inject contrast medias and take care of patients that might have an allergic reaction to those injections. So the medical imaging specialist requires a knowledge of more than just quote-unquote pushing a button to get the image. They also must be competent in patient care. Medical imaging specialists are also prone to repetitive injuries from moving patients or equipment and the risk of being exposed to ionizing radiation. When analyzing stress among medical imaging professionals, some of the most important predictors of stress were communication problems and conflicts between home and work. For medical imaging professionals, we have less time to communicate with patients because our schedule is to provide as quickly as possible the information to treat the patient. So it's kind of get them in, get them out, get them in, get them out. Unfortunately, as a medical imaging professional, we're used to the environment, but the patient is not. And a lot of times, there can be stress caused by just the equipment that they see in the room. In the stress survey, one of the things that was found was that women radiographers or medical imaging professionals, when surveyed, appeared to feel a lack of respect from supervisors more than men did. Men reported feeling less respected by the patients. The survey also showed that women medical imaging professionals, when surveyed, tended to feel more nervous, more stressed, and more upset by unexpected events than did their male counterparts. Another very interesting aspect of the survey was when questioned, women radiographers often felt less on top of things than did men and perceived significantly less control over their lives at work. Interesting also was when you contrast male radiographers or medical imaging professionals with women radiographers or medical imaging professionals in the survey, women radiographers felt safer and had the sense of a more pleasant work environment than male radiologic technologists. In case you're wondering, this survey was done by the ARRT and the ASRT a few years back. They also found radiologic technologists aged 25 to 34 were more easily angered by what could not be controlled than were the older technologists. This again might reflect a lack of social relationships at work, and older radiologic technologists might have been able to more easily vent their emotions than the younger. This survey also showed that medical imaging professionals who were not married felt significantly more discriminated against than those who were married or divorced. Of those radiographers who participated with children living at home, agreed with the statement that work can interfere with personal or external needs. The requirement to be on call and work night shifts, holidays, and weekends affects this finding. Having children at home might increase stress levels when you have to work nights, weekends, and holidays. Two other major imaging studies showed that medical imaging professionals reported the following stressors: inconsistent management and poor management communication. They found often that they had conflicting demands on their time and long work hours and excessive workloads, lack of breaks, and stats caused by a lot of inconsistent patient scheduling and stat exams. Poor interprofessional communication has been linked to decreased quality of patient care and an increased number of medical errors. I should know, I got married to a nurse. Anyway, increased occupational stress due to lack of effective interprofessional communication can lead to poor job satisfaction and burnout because everybody in the hospital thinks all we do is push buttons. All we do is push buttons while they do real medical care. The general nature of medical imaging is a very fast-paced environment. Unfortunately, with this fast-paced environment, it impacts on the communication between the radiology staff, the physicians, and the nurses who have been providing their care to the patients. It is amazing how different an exam would be if you just had a little bit more information from the physician ordering or the nurses taking care of the patient. In order to decrease the number of errors in radiology departments or medical imaging departments, the American Society of Radiologic Technologists has called for further education for radiographers in communication skills as members of an interdisciplinary healthcare team. This not only means do we need to get more information from nurses and physicians, but we need to communicate information to them as to what happened during the exam and the patient's status. Despite recent improvements in interprofessional understanding, conflict and confusion regarding the scope of practice of various disciplinary delineated roles persists and continue to hamper interprofessional communication between medical imaging professionals and other healthcare professionals. Medical imaging professionals need to really understand their scope of practice and what they can and cannot do. And they also need to be aware of the scope of practice for nurses and physicians in different environments. Anxiety brought on by the basic nature of working in healthcare and by difficulty in carrying out professional roles is termed role stress. Role stress can also be delineated into role conflict and role overload. Health professionals who are socialized to carry out one role but are expected to fit into another in the workplace experience role conflict. This type of role stress is caused primarily by a gap between education and services required. For example, when a nurse comes to work on a floor, they are mentored for a few weeks before they are allowed to work alone. But if you get hired on as a medical imaging professional, you may walk through the door on day one and are sent immediately to surgery where you've never been before to do an examination. Once you graduate from ASRT medical imaging training, you'll find that there are several different types of modalities and career paths that you can follow. Everything from mammography to CT to MRI to informatics and management. So again, there is stress in trying to choose your pathway right after school. Interestingly enough, being the director for clinical services and also teaching classes, I never found a student who just wanted to be an X-ray tech. Everybody wanted to specialize. As a director of radiology, I wish that everyone had multi-modality skills so that for those that choose to study nuclear medicine or sonography, there is a different registry. One of the biggest causes of stress for medical imaging professionals is the lack of interprofessional understanding that has been linked to role confusion and territorial disputes. A prime example of this is positron emission tomography, or PET scanning. Although a PET scanner looks like a CT scanner or an MRI, it is a nuclear medicine modality. Interprofessional collaboration within the multidisciplinary healthcare team is vital to its success. Without proper collaboration, all members of the healthcare team become stressed because of lack of knowledge of each other's role and what they should do to treat the patient and provide the highest quality of care to the patient. Traditionally, although radiologic technologists and nurses encounter each other frequently, there's often strained interaction. Poor interprofessional understanding between these two healthcare professional groups is a source of many misconceptions and the cause of many errors in providing patient care. Perception is everything, and it's a two-way street. The radiologic technologist may think the nurse does not want to help, and the nurse may think it is his or her job to stay out of the way of the radiologic technologist. Nurses often perceive that the radiologic technologist does not worry about tubes becoming dislodged or causing the patient discomfort. It is all perception, and the radiologic technologist will have to find a strong voice and speak up to better this intercommunication. Better communication relieves stress on both parties. In a survey of medical imaging professionals, greater than 37% indicated that Nurses were the professional group with whom they experienced the most difficulty communicating, and of the physicians, surgeons were number one with 17.6%. Medical imaging professionals need to work on their communication skills with both these groups to relieve stress. In the same ASRT survey, 92.7% of radiographers or medical imaging professionals agreed strongly in the survey that other professional groups' poor understanding of the scope of practice of radiographers is the barrier to interprofessional communication. Of course, if you went to a physician's group or a nursing group and gave them the same question, they would agree strongly that the other groups do not understand the scope of their professional duties. To get away from problems with communication, we really need to sort of get rid of this tribal mentality or hierarchy within healthcare. So let's take a look at some more of the responses from this survey. The second most perceived barrier to interprofessional communication was job stress. Over 82% of the respondents agreed or strongly agreed that job stress was a barrier. And the third most recognized barrier pertained to professional respect. And a close fourth was understaffing. This is followed by territorial disputes, and the sixth most recognized barrier was intimidation, and lastly was the radiographer's limited understanding of other professions. It's fairly hypocritical for radiographers taking this survey to state that they do not understand what the other professions do, but the other professions strongly need to understand what the radiographers do. The ASRT survey respondents perceived that other healthcare professions neither respected nor understood radiography. In contrast, radiographers believed they respected and understood other disciplines. Demographic variables had a very limited influence on their perceptions. In this survey taken by the ASRT a few years back, radiography problems that cause stress, according to the radiographers, were disrespectful physicians, inadequate pay, unnecessary exams, lack of staff, and a lack of respect. Although the ASRT survey about stress and burnout had the same complaints, I think a lot of the complaints are not valid. Well, I think they're wrong, and let's take a look at a conclusion here is that change is a constant and inevitable part of everyday life. When experiencing stress over the uncertainty of employment, family matters, and increasing career demands, it is important to keep in mind that some things never change. Basic patient care and comfort and the interdependence of coworkers always matters.